Dead bugs are a open kinetic chain isotonic exercise that target the core, the hips, and the shoulders. The concentric movement of this exercise is when the extremity comes closer to the body, and the eccentric movement is when the extremity goes away from the body. Muscles that this exercise target include the rectus abdominis, the iliopsoas, and the rectus femoris. A progression of this exercise can be adding a physio ball that the patient has to hold. This progression incorporates proprioception into the exercise and makes it more difficult. A regression from this exercise can be to isolate the lower extremity movement, which can allow the patient to focus on either the lower extremity or the upper extremity instead of both at the same time.
Proprioceptive exercises are exercises that challenge and develop proprioceptive receptors. So, proprioception helps to stabilize a joint during either a static or a dynamic functional movement. If there's decreased proprioception, that can lead to an increase of or a risk of injury. For this exercise, we're targeting the hip. So, this exercise is called cone pickup. Obviously, first you will be placing the cups one by one onto the surface before you pick them up. You can do this in a pyramid structure. For this exercise, you will be standing single-legged. This emphasizes your balance training. As the athlete comes forward to place the cup on the surface, some cues can be to hinge at the hips, bend slightly at the knee in order to reach forward. You don't want your athlete to have excessive forward movement of the trunk for that reaching method. They are to keep their knees behind their toes. The athlete is to keep this exercise slow and controlled to improve their balance and gain active muscle contraction. Once all the cones are placed on the surface, the athlete can pick up the cones one by one. Muscles that aid in hip stabilization include gluteus medius, gluteus maximus, and piriformis. A progression of this exercise would be to have the athlete stand on an unstable surface such as a Bosu ball, or the athlete can also incorporate a single leg squat after they do the cone drop off or pick up. A regression of this exercise would be to change from single leg to double leg. The AT would be lateral to the athlete to gain a lateral view of their hip flexion and to help with cueing. This is also a safety position in case the athlete loses their balance.
For our functional exercise of the hip, we have a resisted hip flexion as well as extension while balancing on a single leg. To set up your patient for this exercise, you need a resistance band tied to a stable source. And as you can see here, this is a very complex movement that works the entire kinetic chain. Your muscles that are involved here are the intrinsic foot muscles for stabilization. You're working your hamstrings as well as your glutes and external rotators, and then your hip flexors as well as your abdominal muscles. And you're also getting some upper body involvement as well with the arms pumping forward. This exercise mimics a very key component to athletic performance, and that would be sprinting or running. This has both open and closed kinetic chain components. As you can see, the right lower extremity is moving in an open kinetic chain, while the left portion of the lower body is stabilizing in a closed kinetic chain pattern. The concentric contraction occurs here when the resistance band is at its strongest, being when the knee is exploding up towards the head, and the eccentric contraction of the hip would be when you are bringing the leg back down as if you're planting in a running motion. Some cues to give your patient would be to stabilize their foot muscles, actively engage them, tighten your glutes, your hips, as well as your core, and drive the knee up explosively, yet controlled. And while you are eccentrically contracting or bringing the leg downwards, control the leg in a slow motion. Because this exercise is functional and is a complex movement. You would really want to be sure to drive those cues to your patient and give them any corrections as they move forward. You can progress this exercise, as you will see in the future videos, by changing the surface or the tension. As far as reps are concerned with this exercise, you can perform anywhere from 8 to 10 reps on one side and then switch sides. However, being that this is a complex movement and that there are a lot of muscles involved as well as stability, you want to encourage your patient to perform good reps as opposed to high volume with poor form. As you can see here, pictured in the video, would be a progression of the same exercise. All of the cues remain the same. However, you are positioning your patient on an RX pad. This would force the muscles to work harder to stabilize as well as contract concentrically and eccentrically. The last progression of this exercise would be to perform the movements on a Bosu ball. This is the most unstable surface of all three surfaces, so it would therefore cause the most strain on the body to not only perform the movement in a controlled manner, but also to stabilize and to be able to balance yourself throughout the movement. Some things that you can do if your patient loses balance is have them touch their toe at the bottom and perform another rep.